There are many ways to be a patient advocate, and as a result, there are many approaches that can be taken. In this module, we'll be going over a few possible approaches to patient advocacy. We'll also point out a few of the general benefits and limitations of advocacy work. This may be helpful for patient advocates looking to develop their own style and approach to advocacy without overstepping any professional or personal boundaries. This information can also prove valuable to patients who may be unfamiliar with the roles and boundaries of advocacy. Familiarity with the material by both the patient advocate and their client can ultimately culminate in a more effective and fulfilling working relationship. Citizen advocacy occurs when ordinary citizens are encouraged to become involved with a person who may need support in their community. The citizen advocate is a volunteer and accordingly is not motivated by money or related conflicts of interest. The relationship between the citizen advocate and their advocacy partner is on a one-to-one, long-term basis. It is centered on trust between the advocate and the partner, and is not usually done through an organization providing an advocacy service. The advocate supports their partner using their informal skills and talents, rather than being trained for the role. Note as well that this kind of advocacy is not necessarily focused only on health matters. Speaking up for your interests and rights, or self-advocacy, is the ultimate aim of most advocacy approaches. When self-advocates come together, they're often referred to as a group or collective. Group advocacy happens when a group of people who are all facing a common problem formally get together to support each other over specific issues. Individual members of the group may also support each other over specific issues. The group as a whole may campaign on an issue that affects them all. A collective voice can be notably stronger than that of an individual, as groups are more difficult to ignore and represent the thoughts of many. Being part of a collective advocacy group can help to reduce an individual's sense of isolation when raising a difficult issue. And again, no structured training is required for this work. Issue-based advocacy, also known as one-to-one, individual, or professional advocacy, is provided by both paid and unpaid advocates. An advocate helps a client represent their interests and/or views if the client is unable to do this themselves. The advocate provides representational support and information on specific issues, but not advice. The support can be short or long-term. This kind of advocacy work is more likely to be associated with wider life matters like personal finance, navigating law, or civil rights. Non-instructed advocacy is taking affirmative action with or on behalf of a person who is unable to instruct an advocate due to issues of capacity, for instance, comprehension or communication issues. An individual might be able to express what they want, for example, to go home, or a view of what they like or dislike, but may lack the capacity to instruct an advocate as to what exact action to take regarding a particular issue. The non-instructed advocate seeks to uphold the person's rights, ensure fair and equal treatment and access to services, and make certain that the decisions are taken with due consideration for all relevant factors, which must include the person's unique preferences and perspectives. This kind of advocacy work is often with clients or partners who have significant physical or communication needs and may be court-ordered and performed by a professional psychologist or counselor. Peer advocacy happens when individuals share significant life experiences. The peer advocate and their client may share age, gender, ethnicity, diagnosis, or related issues. Peer advocates use their own experience to understand and empathize with their advocacy partner. Peer advocacy works to increase self-awareness, confidence, and assertiveness so that the client can speak out for themselves, lessening the imbalance of power between the advocate and their client.